Okay, we're recording. So here we have a wonderful patient from Massachusetts, correct?
Absolutely.
And several years ago, he had a problem where you had some traction on the macula, but that developed into a severely large floater. And you went to Tufts University, one of their associated doctors, and the doctor told you to...
The doctor said I'd have to live with it, and basically that hopefully gravity would take over and it would pull it down so that I would no longer be problematic with my central vision. Now I enjoy fly fishing, which involves not only tying flies but tying flies onto a leader tippet, and it's very small work. Mm-hmm. It was absolutely frustrating because I ordinarily would have been able to put the leader through the eye of the fly with one shot, but with this problem it was taking me 2, 3, 4, 5. Sometimes I'd get frustrated and just say the heck with it. And but I've noticed that since I've had the laser treatment, that my closer vision, even with glasses, is not blocked by the central vision in my right eye, and I am right eye dominant.
Right.
So it made a tremendous difference. Not only that, but also in reading. I like to read, and my eye would get tired. It would water, and I'd have to put the book down and come back an hour later. And I've been reading without any problems.
We show a little bit of this membrane here. I don't think we can see that very well, but what we had here was not a run-of-the-mill floater like I have or people our age have, but this was actually the surface bag of the vitreous gel, which had been thickened like a membrane, and it went clear across your field of vision. And when you came in, your visual acuity was 20/40 with correction. I diagnosed a membrane, this is not a common floater. I'd say this is fairly rare in patients that complain of floaters. I've done maybe 5 to 10 of these in a decade or two. But it was fairly dramatic. What we did here, we actually unzipped this membrane, let it retract to both sides, which is an unusual method of treatment because usually I can pulverize the floaters, but this was different. And your visual acuity, as we measured it on the eye chart when you came in, was 20/40. On the same eye chart just before we are having this discussion today, your acuity was 20/25 on the eye chart. So that is fairly significant. And of course, your doctor in New England said that, you know, it would go away with gravity. And maybe for 90% of patients that come in with eye floaters, you could say that across the board. But it doesn't apply to everybody. And we did just 2 laser sessions. After the first laser session, your visual acuity, I think, was 20/30 on the eye chart. And after we did the second session last week, your visual acuity was 20/25 on the eye chart. So that to me is a fabulous success. The question, of course, was whether we should try to go after some of this peripheral stuff. My opinion, I think when we get a great result like that, hold off. We can always go back. We don't want to mess this up because the vitreous is a dynamic fluid and you shoot at one area with the laser and that can affect the mobility of something in another area. So nothing is perfect in medicine, but this is as perfect as I would like to see it. And after 2 sessions, it's a minor miracle, and we're always happy to succeed where others have said nothing can be done.
Well, I'm extremely happy with the results, and you can take that to the bank. And as far as I'm concerned, Dr. Keller is a man to see.
I don't know if I could take it to the bank. It's really not that much in the scheme of things, but it certainly is rewarding emotionally. And the pay is good, I have to say that. Thank you very much, and best wishes to everybody.